Morphine Addiction
by Andy Verlin-Clausen,
Ashton Gola,
Brooke Adair,
and Sierra Hoyt.
What is morphine? Morphine is a powerful opioid anesthetic, and it's delivered from an opium prophy, and it's classified as Schedule II controlled substance. How does it work? It works by binding to opioid receptors in the brain and spinal cord to reduce sensation of pain, sedation, and sometimes euphoria. What is it used for? It's used for moderate to severe acute pain. Some examples of this would be post-surgical pain, cancer-related pain, and end-of-life care pain. And some common side effects are nausea, drowsiness, and constipation. And who should avoid morphine? People with severe asthma, head injuries, or people that have liver or heart failure. The history of morphine. In 1804, Frederick Sir Turner isolates morphine from opium and names it morphium. In 1853, the invention of hypodermic needle increases the use of morphine, and in 1860, in the American Civil War, lots of soldiers were given morphine if they had surgical pain, gunshot wounds, and soldier's disease. And then in the 1900s, opioids were used more regularly, and in the 2000s, as addiction issues increased, the government regulated morphine with the Harrison Narcotics Act.
Molecular effects. Morphine binds to opioid receptors, activating a family of kinases called the G protein-coupled receptor kinases. The three subunits of the G protein form two complexes, the alpha-GTP and beta-gamma dimer, which participate in intracellular signal transduction. This inhibits adenylate cyclase activity and reduces cyclic adenosine monophosphate levels. Activation of protein channels are also observed, which leads to increased hyperpolarization of the cell, which is when the cell's membrane potential becomes more negative than its resting state. The beta-gamma dimer directly blocks the calcium channels and reduces calcium concentration. Our key figure. The red circle, labeled DA, represents the dopamine receptors in the brain. The green circle, labeled GABA, represents the GABA receptors. This figure shows how morphine affects these receptors to produce a euphoric effect. Normally, the release of dopamine from the dopamine receptors to the nucleus accumbens is regulated by GABA neurons. When giving a patient morphine, the morphine enters the VTA, ventral tegmental area, to inhibit the GABA neurons from working properly, allowing dopamine production to run freely. This causes extreme pleasure and euphoria for the patient, which leads to addiction.
How morphine addiction works. Addictions, or substance use disorders, are chronic illnesses that chemically change how the brain works and make it very difficult to control drug use despite harmful consequences. Morphine addiction develops because the drug strongly activates the brain's pain relief and reward system, and these chemical changes reshape the brain's reward and motivation systems, which trains it to depend on the drug, and with repeated use, the nerve cells adapt so that the same dose produces less effect, which is called tolerance, as well as making the body physically dependent on use of the drug. In summary, the typical cycle of morphine dependency is use of morphine, experience of euphoria and relief, making the brain adapt, tolerance and dependencies develop, withdrawals feels increasingly severe, and then morphine is taken again to mainly stop feeling sick rather than to get high. This relief from withdrawal itself becomes rewarding to the brain, locking in a cycle of repeated use and making quitting without help very difficult. So essentially, over time, a person needs morphine not to get high, but to simply feel normal and avoid withdrawal. Why we're interested. Morphine is a highly effective medication that used to manage severe pain, making it one of the most commonly prescribed pain medications in hospitals. We are interested in this topic because, as nurses, we will likely be interacting with the drug frequently. Thus, it is important to understand the physical and psychological dependencies the drug causes in order to be most effective at preventing morphine addiction in patients, as well as providing help and resources for those struggling with addiction. Additionally, the topic of morphine is important because it is a major public health crisis. The US and other countries are currently in the midst of an opioid epidemic, which includes morphine. Understanding morphine addiction is vital for developing better prevention and response strategies to this epidemic. In addition, this is interesting because morphine addiction relates to topics we have discussed a lot in class. As an alkaloid made up of the elements carbon, hydrogen, nitrogen, and oxygen, Understanding morphine necessitates an understanding of elemental properties and bonding. In addition, the specific molecular structure and spatial arrangements of the morphine molecule is what allows it to bind to and activate the mu opioid receptors in the brain.
And then our exam questions are, question 1, what makes morphine addictive? And then question 2 is, what long-term effects can morphine addiction have on the body? The answers to these questions are, morphine is addictive because it activates the opioid receptors, triggering dopamine releases in the brain's reward pathway. This produces euphoria and reinforces repeated use, leading to tolerance, dependency, and addiction. The long-term effects addiction can have on the body is respiratory depression, hormonal imbalance, constipation, increased pain sensitivity, withdrawal symptoms, and risk of overdose. And then these were our references.